Welcome to Working Smarter, Concise Compliance Conversations featuring Wendy Rubis, sponsored by Village MD, primary care physicians, practice medicine the way you've always wanted, data, resources, and clinical decision support to care for your patients inside and outside the exam room.
Hi, welcome to Working Smarter. I'm Wendy Rubis, General Counsel of Village MD, and today we're talking about Medicare Advantage marketing. We've got one of the best in the business joining us to help us understand these rules and how they've changed recently, Michael Adelberg, Principal at Faegre, Baker & Daniels. Michael, welcome.
Hi, it's a pleasure to have a chance to speak with you.
I think it's important to just start with the reason we have these rules at all, so to connect back to the purpose and really to help you understand them. And of course, for years and years and years with Medicare, there was no selection of different options. There was no intermediate third parties that were private companies that had a commercial gain to make in plans. And so when Medicare opened this up to privatization in a sense, or working through these third parties, commercial payers, they wanted to make sure that beneficiaries weren't going to be misled and that there wasn't going to be a problem with people not understanding their plans. So they put in place these marketing activity requirements. And basically, the whole point of these is just that beneficiaries aren't inundated with information and that the information isn't false. So if you remember nothing else, that's the main thing to remember about the marketing rules. But Michael, let's go through these in a little bit more detail as far as what's permitted and what's new.
Sure. Medicare Advantage is the private plan option within the Medicare program, and Medicare contracts with managed care companies across the United States. Those managed care companies are required to cover all Medicare A and B services. In addition to that, they very often include Medicare Part D, and increasingly they include supplemental benefits that are not covered by Medicare. So the program is growing. It's more than 1/3 of people with Medicare now, and it's growing roughly 2 million people a year at this point.
So, I think another difference is people have to enroll in this, whereas with Medicare, you're just sort of in. So if a patient's enrolled in a plan, do they have to re-enroll every year, or do they just roll over?
That's a good question and good point. When someone comes into the Medicare program, they have the opportunity to select a Medicare Advantage plan, but if they do nothing, they default into Medicare Parts A and B. And when someone does select a Medicare Advantage plan, at that point, their enrollment will roll over with the MA plan annually each year after that. But they have the option during enrollment season to select a different Medicare Advantage plan or to return to original Medicare.
Okay, so in the purpose of marketing then, if a patient's in the plan, they're going to continue in that plan unless it takes an affirmative act to make a change. The next thing, just again, as background, is we have here identified some of the pros and cons of original Medicare and Medicare Advantage. And those of you that are listening, you can see this material in our show notes, but it's probably more than we can sort of read. But Michael, you want to just give us a high level, the pros and cons of original Medicare versus Medicare Advantage?
Sure. Original Medicare has the primary advantage that an individual with Parts A and B, and particularly if they have the good Medigap to layer on top of that, they can essentially go to any provider that participates in Medicare, and most do. They can go to any provider as they wish and get the services that they wish to when they want to. And that agency and choice is the primary advantage of original Medicare. Medicare Advantage offers a network product so that the people who opt into Medicare Advantage have to stay in network or face significant coverage gaps if they go outside. However, Medicare Advantage offers lower cost sharing than original Medicare, and Medicare Advantage increasingly offers a variety of supplemental benefits, whether it be dental or transportation or over-the-counter drugs or a number of other things. And those services are generally not available in original Medicare, even with a Medigap product. And then Medicare Advantage offers catastrophic protection. And it also, for people with significant illnesses, Medicare Advantage plans have different care management programs, which can be helpful for helping an individual successfully manage a chronic disease.
Thank you for the summary. And one of the things we like to say in Working Smarter is that we like to have concise compliance conversations. I think it's so hard to do that when it comes to this. This is such complicated material, and the marketing rules in particular are very complicated. So, as I said, we'll put this information in our show notes, but that's a helpful just sort of foundation for our listeners. It's a little strange to talk about marketing as a regulation. So, Michael, why don't you give us a background of why these rules are here? What is the public policy or the concern that CMS is driving at with these rules?
CMS, in looking at Medicare Advantage marketing, tends to be pretty protective because seniors have a limited understanding of the Medicare benefits and the insurance terminology that wraps around it. We just discussed their limited knowledge. So CMS wants to protect its members and the interest of their members and make sure that if someone joins a Medicare Advantage plan, they're joining it with reasonable understanding of what they're selecting and that they're joining it for the right reasons and they're not getting induced to join based on maybe a gift or some other inducement.
So these rules, these marketing rules, are really designed for plans, brokers, all of the different entities involved, but there are rules that apply to physicians as well. So let's kind of go through, and again, to our listeners, this is complicated stuff, so stick with us here. One of the good things that's come about recently is some of a lessening of the rules around provider marketing, which I think you're going to go through with us. The first thing I just want to say is to our physicians is when you're seeing a patient and the patient has questions or you have things to tell them that are a part of the course of care, there is no prohibition on that. If there's a chronic condition and the plan has something for that, or if you think the plan has a gym membership, whatever it is that's relevant to the patient in the course of treating them in the exam room, that's always appropriate, and this should not ever be viewed as preventing physicians from doing what they feel they need to for their patients. But beyond that, why don't you take us through the marketing rules and let us know what's new here?
Sure. And exactly as you said, Wendy, CMS has taken a number of steps to liberalize some of the marketing rules. And specifically with regard to what healthcare providers are allowed to do, I'll highlight a couple of the more important new flexibilities. One is that CMS has liberalized the ability of healthcare providers to co-brand with MA plans so that if there is material that you want to distribute in your office about a plan and your relationship with the plan, you have the ability to do that. You also have the ability to make referrals to plan marketing staff as long as you are not doing so with regard to unsolicited contacts. You're also able to distribute plan materials when someone comes in and leaves your office. And if you are part of an office that has common areas where people congregate and where care is not delivered, MA Medicare Advantage marketing sessions can even be held in those common areas.
So I think sometimes it's helpful in order to understand what you can do to kind of describe what's not permitted. Just off the top, we'll say lying. Some of this is under the category of obvious, okay? Don't be shady. You can't lie or misrepresent. Also, anytime there's cash in envelopes or even checks or even new cars, houses, whatever, cash and gifts from the MA plan for marketing or to patients for enrolling, but of course everybody already knows this, but we have to say that's prohibited. Where I think some of the nuance comes in that you can help us with is this idea of what do you do in the common area versus what do you do in the room. Can you kind of talk to us about that?
Yeah, CMS wants to draw a distinction here because as a physician or another healthcare provider, you have tremendous influence and, dare I say, even power over your patients during the delivery of care. There's an enormous amount of deference and respect that most people show to their healthcare provider. And so CMS does draw a distinction between what can occur in common areas versus areas where care is being delivered. With respect to common areas, CMS has liberalized the rules quite a bit. You can put up plan materials. You can hold marketing events in common areas. You can certainly distribute materials. In the area where care is provided, you can certainly discuss plans and plan features as part of the course of care. So if you're talking about someone who will need to take a new drug and the drug is potentially expensive, and you're aware that a drug it will be less expensive on Plan A versus Plan B, you can certainly discuss that. And you can even say, and when you leave the office today, you really should pick up some of our materials on Plan B in case you might want to join. But what you wouldn't want to say is, Plan A is great and is going to take great care of you, and I've had terrible experiences with Plan B, and I really don't think my patient should be on it. You'd want to avoid those kind of sweeping general types of statements, particularly in a derogatory way about a plan that's not based on something that's straight and factual.
Got it. And to that extent, then, if you are holding these marketing events, you wouldn't want to do that in a cross-selling, so you wouldn't want to add it with another product, which I don't know what other products physicians would be having marketing events about. And similarly, you wouldn't want to mix that in with an educational, like a health fair educational session, although you can do it right before or after, but not at the same time.
Yes, I'm glad you raised that, because this is an area where CMS's guidance has changed and has liberalized things for providers. If you wanted to have a marketing event in coordination with it, you can, as long as they are different events. So one event could go 10 to 11. The other event, certainly in theory, could go 11:01 to noon.
Which again, some of this is common sense. And then of course, there's the don't be creepy rules about knocking on people's doors or spamming them with unsolicited mail. The mail issue is, if you have a new affiliation or a material change as a physician, you can make your patients aware of that, but otherwise not sending them a lot of unsolicited mail. Do I have that right?
That's right. CMS, again, does not want to see healthcare providers become a marketing wing of the Medicare Advantage plan.
Right. Okay. And I think the last thing is just a note about the timing. So what is the enrollment? And the marketing materials have to correspond with marketing season. And can you remind us what that marketing season is?
Yes, marketing season runs October 15th to December 7th.
That's very helpful and hopefully helpful to our physicians. One thing I will say is, if you're working with VillageMD, we do have marketing and legal staff here to help you. And if you're not working with VillageMD, it's a good idea to work with your counsel. Again, we're giving you a high level, but these rules are quite complicated. So we have a strategy here at VillageMD for how we handle this, and feel free to give us a call and we'll help you with that. So Michael, thank you so much for joining us today. Is there anything else you think we should mention to our listeners?
No, well, first of all, thanks so much for having me, Wendy. And I think the work you all do is so important. And I would just offer as a closing thought that Medicare Advantage is growing, and the ability to partner successfully with MA plans, I imagine, will become increasingly important for more and more providers.
And we think that's great news for VillageMD, because this is allowing us to provide the care that our providers have always wanted to. So, Michael, thank you for joining us.
It was my pleasure. Thanks so much.
Thank you to our sponsor, VillageMD. We hope you will join us for future concise compliance conversations.